So I'd like to jump right in and hand over to Joe Puri. We're delighted to have Joe with us from 3IE. Joe Puri is currently the Deputy Executive Director and Head of Evaluation at the International Initiative of Impact Evaluation, otherwise known as 3IE. I think we're all familiar with the work of 3IE and with Joe in particular. Joe has more than 21 years of experience in policy research and development evaluation, including evaluations for the World Bank, the UNDP, UNICEF, and many, many others. Both 3IE and Joe are known for their contributions to many areas of evidence-driven aid, but Joe is with us today to talk specifically about one area of 3IE's work, which is on evidence gap mapping. 3IE hosts an interactive online platform for its evidence gap maps, and we'll be sending you the link to that site through the chat box, which you can click on. We'll also provide it again at the end of the webinar today. So I'm going to hand over to Joe now, who's going to talk us through a bit of their work on gap mapping. Over to you, Joe.
Thanks, Alice. It was interesting to learn as people out there, I think there are about 140 people out there who are listening to us, that only 7% had heard about evidence gap maps. So I'm hoping that we can have an interesting dialogue around this today. Thank you, everyone, for being here, and to ALNAP for this opportunity and this wonderful webinar. Okay, so I'm going to be talking today about gap maps, and really talking about what are gap maps and what can they tell us. A lot of you have seen a lot of newspaper articles, information on different things, a lot of which give you contradictory advice on what to do and what not to do. These are just a few examples on your screen on how different so-called good magazines have given you contradictory advice about coffee. So, is coffee good for you, bad for you? What should you do? Does it lead to cancer? Is it good for you and good for your heart? What do? There's clearly an information overload. And this is where gap maps come in. So where we start off from, we start to understand when we are starting with any field, really. We start with trying to understand what is the overall evidence that we have in that space or in that area. Our first port of call is the Impact Evaluation Repository of 3IE, which is a free service where really a lot of the impact evaluations are put or collected and put as a free service for everyone and anyone around the globe. And this repository essentially has about 2,600 impact evaluations currently. So we first look there to then understand, well, what do we know about a specific question or a specific topic? And you can search this repository pretty nicely. From there, we then go on to then understanding what sorts of systematic reviews exist. And I know that one of my colleagues is going to be talking about systematic reviews, so I'm not going to go over that. But essentially, what these systematic reviews in the repository tells us is the amount, what we know exists in terms of evidence. But how do we understand what is the extent of this evidence and what is it saying? This is where gap maps come in. Gap maps can be really good tools to understanding where is it that we should be looking at research and research that matters. So this is just a gap map looking at a few at different interventions and different outcomes. Let me explain what this map is showing to you. Okay, so essentially what this is saying, a gap map essentially is a matrix where you have interventions, where you have interventions on your left-hand side, and you have, on the top of your screen, you have outcomes. But essentially, the first thing that gap maps help you to do is they identify key gaps so that you can understand as to where primary studies should be undertaken. They also help to understand where you do have quite a few primary studies, but where you haven't systematically synthesized this evidence, and where there may be opportunities to do so. And the yellow circles on your screen essentially show you that opportunity. The opportunity to synthesize evidence where you do have a lot of primary studies, but you don't know as to what those studies are telling you in a net. What should you do if you have a lot of good studies and some of which may be providing you with contradictory information? These are what gap maps look like, but where do you start from? Okay, so gap maps essentially have outcomes around your horizontal axis, and they list interventions along your vertical axis, yes? And then in this matrix, they essentially show the amount and the quality of evidence. So the bubbles on your screen are essentially telling you whether you have systematic reviews on these topics. So for example, if you're looking at the row which says cash transfer interventions, and if you're looking at enrollment, you essentially have a big gray bubble which says that yes, there is a systematic review and it has lots of studies in it, but it also has protocols and other impact evaluations which are signified by the green, orange, blue, and red bubbles, which are essentially telling you that there are some things that are not been included in the systematic review. There are still others that are protocols, and still other primary studies that require further synthesis. This is essentially, then each one of these bubbles is also connected to a study which links itself with the 3IE repository. So essentially you can click on these bubbles and it takes you to the list of studies that are available that have populated that bubble. So in some senses, this can be a very nice tool if you just want to understand, well, if you just want to understand what is the extent and what is the density of evidence that I can be reasonably confident about in a particular area that is also informing me a little bit about the outcomes that I'm interested in. So how do you set up a gap map? There are several steps included in it, and we can talk about this in detail later, but essentially you have to develop scope. You have to set what are called inclusion criteria, and I'll talk about those in a minute. Using these inclusion criteria, essentially criteria that helps you decide what are the big outcomes that you want to understand, what's the kind of population you want to target, what are the sorts of interventions you want to look at, and what are the standards of evidence that you're using in your search. You set up what are called inclusion criteria, and using these, you then do an exhaustive, comprehensive search on all of the relevant databases that are available out there. And searching these databases exhaustively and extensively requires a lot of effort because it essentially means that you have to have the right search strings. We end up at 3IE, we end up using a search specialist, a library science search specialist who essentially creates these search strings for us, and then we run through at least 10 or 15 databases when we are doing a gap map. All of these usually land us with, at a minimum, 20,000 or 30,000 hits. This is almost equivalent to you going to Google and then putting out a search string and trying to understand the evidence on a certain topic, except because you're using inclusion criteria here, you're using some search criteria which also are looking at standards. Once you have these 30,000 hits, you then go through a process of title screening, abstract screening, and text screening to then understand as to what should be the studies that are finally included in your final list of studies that you will use to really populate your gap map. And that's the data extraction process and then the presentation and analysis. So essentially what you end up doing is, and if you see your screen, the evidence gap maps that 3IE has produced till now are available on our webpage. That's also, I think the link has also been provided very nicely by Alice. Thanks, Alice. An important part about gap maps is setting the scope. So remember how I spoke about the interventions along the vertical axis and the outcomes along the horizontal axis? These require quite a bit of discussion, but they're also extremely useful because they really give you a good opportunity to engage with some of the key stakeholders in the area that you're working in. So it's not just a desk study. You're really working with people on the ground to understand, well, what are the sorts of interventions that you should be interested in? What are the categories of interventions? Because as you can imagine, these interventions can be thousands of millions and can be categorized in very, very different ways. But this consultation exercise that you set up gets you to the scope. In humanitarian action, given our own shortage of evidence and the big shortage of funds, we know that scarcity and need requires that we know what the evidence is. So I'm quickly going to show you the evidence needs map that we ended up creating for humanitarian action, where on the horizontal axis you have all of the outcomes, the outputs, and the impacts. On the vertical we have the categories of interventions. And essentially what we found was this. There's a huge importance and need for evidence in education, livelihoods, WASH, nutrition, health, early recovery, essentially everything. And last but not least, the gap map itself showed that most work in this area has been done in health, nutrition, and peace building, but there are very, very few impact evaluations. And at the time that we did this, there were less than 40. My last slide on this is really when we did a quality assessment of even the less than 40 impact evaluations, which has since been updated and we are working to update it, we found that the quality of these impact evaluations was actually not very good. Only 29 had a theory of change of the 39, but the ones that did have good standard in terms of what we called having a counterfactual did not have a balanced test. And they did not do, and 29 of these did not do any power analysis to show confidence in their results. So my last result is there is high need and low availability of rigorous evidence for humanitarian assistance. And these are specially required, primary studies are specially required to answer questions related to what works for whom and why. Thank you.
Great. Thank you so much, Joe, for a really clear overview of a really important approach to trying to manage what you called so nicely the information overload problem, which is really, really critical. So I look forward to diving a bit deeper into that method and how it can be used by humanitarian decision makers in the Q&A.